Hello and welcome to For Kids' Sake with Dr. Lance Chilton. I am your host, Rosalinda Roman, and this show is all about the health and well-being of children. On today's show, we're going to discuss the importance of reading in early childhood and how parents can deal with reading problems like dyslexia. So it's one hot topic like we always have here on the show. And then later in our show, we're going to find out just how common seizures are in children and some ways that doctors are treating some of the children who suffer with seizures. So lots of important information. Let's begin by saying hello to Dr. Chilton.
Hi there, Rosalinda.
Always nice to see you.
Thank you. Nice to be with you.
And so dyslexia is actually a difficult topic for a lot of parents because reading is so important and it's reinforced in schools, and we're told from the time our children are little to read with our children and encourage them to read, but that's not always an easy thing for everybody.
Well, it's certainly important that however well your child ends up reading, that you read with your child. And I'm sure you did that with your children and are doing it with your children, talking to them and reading to them and giving them the benefit of all the words that you know.
Yeah, and we read in Spanish and English, so that's kind of funny. But the subject of our show today is dyslexia and some other learning disabilities. And I have a personal experience, at least with this subject, because my own husband he calls himself severely dyslexic. And when he was a young boy, he was told he could never make it through medical school and not to even try being a doctor because of his dyslexia. And I'm happy to say that the reason I tell the story is because he is now a doctor, so there is hope.
That's a wonderful story that will help the parents who have children who have learning problems and reading problems.
Yeah, there's a way, and nowadays there's lots of options. And we're going to talk in the next segment with another expert who's going to share more information on this subject with us. Right.
Dr. Richard Campbell will be our guest on the next segment of this program. Dr. Campbell is the head of neuropsychology in the Department of Pediatrics at UNM, somebody I'd really like to send all of my patients to so that he could tell us what their strengths and what their weaknesses are. But particularly those children who have reading problems and learning problems, I want him to help both the parents, me as their doctor, and also the child by diagnosing it well.
That really does sound like a very invaluable experience to be able to understand what your child's weaknesses and strengths are in that way. So I look forward to that segment. And another segment after that we're going to talk with, you go and interview medical residents.
Right, our pediatric residents do wonderful things in the community. Joe Harmon, who is the interview subject at the later part of this program, is an expert in neurology, particularly in seizures. And he'll be talking with us about the frequency with which we encounter seizures and what the differences and similarities are between epilepsy and seizure disorders.
And are seizures common in children? I'm not familiar with it myself.
Yes, they are. About 1 in every 20 children has seizures with fever when they're young children, and about 1 in 100 children have what we call epilepsy or repeated seizures.
Wow, so that should be a very enlightening segment as well. And one of our favorite and very enlightening segments after that, at the end, because I want people to stick around, is the library segment where you get out into the community.
Well, I love the libraries, and in this case, we'll be going out and talking with parents in one of the branch libraries around the city and answering their questions.
Excellent. So lots of great stuff here on the show coming up. So I hope that everyone will stick around here on For Kids' Sake. And we'll be back with Dr. Chilton and Dr. Richard Campbell after this.
There's no place like home.
Getting home safely is just a click away. But making sure your child is in the right seat is just one of the steps down the road to safer travels.
I don't know how it works.
Find the right seat for your little one's age and size.
We've done what you told us.
There's no better way to get home safely. Know for sure that your child is in the right seat. Get all the facts at safercar.gov/the right seat. Brought to you by the National Highway Traffic Safety Administration and the Ad Council.
Welcome back to For Kids' Sake. Well, research suggests that 17% of children in this country suffer from dyslexia. That is a large percentage. If you didn't know anything about dyslexia, you have come to the right place. Here to talk with us today with Dr. Chilton is our special guest, Dr. Richard Campbell. He is professor of psychiatry and pediatrics at UNM. So very nice to see you. Thanks for joining us.
Thank you for having me.
It is a hot topic. I don't know if you heard in the intro that I have some personal experience because my husband was diagnosed with dyslexia when he was in grade school. But more and more I'm hearing of friends' kids who have been diagnosed very early and they're getting new intervention. So that's kind of encouraging.
It is, and your example of your husband is a success story which we hear a lot about, where we now know after 25 years of research what is wrong with kids who have reading disabilities and really how to best help them so that they can overcome those disorders.
So we live in a computerized environment, Rick. Why should anybody need to read anymore?
Yeah, well, because even when you're reading on the computer, you are reading and you have to read. But we also need to be able to read in other forms as well. And so yes, computers make it easier for us and lots of pictures, but we still need to read. And it is the most critical academic skill to have for success.
So if a parent is trying to help a child to read, how can they help them in their early years?
Well, you mentioned a little bit earlier, talking to your children, talking to them a lot, talking to them about what they're feeling, but also what they're experiencing. Playing word games with them, rhyme games, can be very helpful in terms of developing these language and phonological processing skills.
So what should we be reading to our kids and what should we make them read?
I don't think that there's necessarily something that one needs to say you have to be reading this. It's just important to be reading and to be practicing that reading. I think that reading comic books is great. Reading novels or picture books are great. Reading sports pages are great as well.
You said that you were a sports fan and learned it from reading the sports pages.
Definitely. It's my passion, and that's one of the things. You find what kids enjoy, what their passions are, and then allow them and encourage them to read in their interests.
So they don't have to read Crime and Punishment
Right.
to succeed.
Not at all.
Yeah,
Not at all.
I've seen parents think they have to, go with some curriculum or something specific. You have to read this book, and I find with my nieces and nephews and my own kids, when you give them something that they're interested in, they don't even necessarily know they're reading. They're into the subject and they get excited about it. So I have a nephew who said, I don't like to read, and I just laughed because he was reading a lot when he was with us, and it's just because he had books that he really was interested in.
I think that's important to find what they're interested in and then giving them and enriching their reading experience that way. I heard that earlier you talked about how kids who have difficulties learning to read, they don't enjoy it and try to avoid it. And what we find is that if you try to get them to read things that are of interest to them, and just reading to them or taking turns in terms of the reading can be very helpful.
So what about dyslexia? If someone has been diagnosed, are there tools now? I know there are, from when my husband was younger, there's got to be a whole range of tools that didn't exist back then.
Yes. Dyslexia is not a well understood disorder, or used to be not a well understood disorder. It used to be thought that it was because of some sort of visual problem is why they had difficulties learning to read. And we now know that reading is primarily a language-based disorder in which they have difficulties learning to recognize individual sounds, or what we call phonemes, and then learning how to associate those phonemes with some sort of a visual symbol like letters. And from that we've learned that those are the core difficulties with reading disabilities. We now know that there are certain sort of specific interventions that are most helpful to developing those skills in kids. Specifically, we know that using direct instruction and explicit instruction on phonological awareness, teaching phonological coding skills, decoding skills, learning the sounds that go with the letters, and teaching those intensively is what's most helpful in terms of teaching kids to read and overcoming dyslexia.
Now, you're talking about what we call remediation, improving one's ability to read. But don't we need to use bypass strategies at the same time?
There are times when in course of learning that we want to still allow them to learn by other means. And so using demonstration, modeling, visual sort of strategies can be helpful. Providing accommodations for kids in school can be very helpful. Reading, when they're needing to learn a certain content, having them read to rather than requiring them to read it. Or giving them more time to do academic activities can be helpful.
One of the ways in which some people treat learning disabilities and reading problems in particular is with special lenses or with visual training. Tell me what you think of those.
Yeah. The research has been pretty clear that that's not a very helpful intervention for kids with reading disabilities. In fact, I think the American Academy of Pediatrics has come out with a statement in saying that.
I wondered about something similar to that because I recently have a friend whose child is dyslexic, and she posted on Facebook that there's a new font that's called Dyslexic or something like that, and the idea is changing the font in the print made it easier for children to read, and I wondered if that had any credence at all.
I haven't necessarily seen good research that would sort of verify that at this point. The research has been very strong, developed over, as I said, 20-some years, and culminated in a national reading panel consensus in which doing direct instruction, using explicit instruction, multisensory sort of approaches to teaching phonological awareness abilities and phonological coding is really what is most helpful for helping kids learn to read words. Now, we also need to recognize that there's more than just decoding words, and you have to be able to understand what you are decoding. And that comes into what we call reading comprehension. And we know that there are kids who have difficulties with reading comprehension but may be able to decode okay. And that's where we need to sort out what their strengths and weaknesses are to better target and develop those skills that will help them with their reading comprehension.
And schools are now better, a lot of schools are better equipped to handle that, right?
Definitely. When I came back to New Mexico 20 years ago, my experience was that most teachers, special education teachers, did not have the skills or the training to help in terms of remediating reading disabilities. Now, almost without a doubt, most special education teachers are very well trained in terms of helping to develop these skills in kids. And it's been nice to see that development over the 20 years that I've been back.
Unfortunately, it sounds like there still are no quick fixes for this.
I'm really not aware of quick fixes for helping with this condition.
But one fix is to get kids to someone like you to look at those strengths and weaknesses.
Neuropsychological evaluations can be helpful in terms of identifying what their weaknesses are in terms of their cognitive abilities. We look to see what cognitive deficits, particularly core cognitive deficits, that we know are related to dyslexia and see whether they show weaknesses in those areas. We also want to determine whether there are other sort of problems in addition to the dyslexia that need attention. And we know that there are a number of conditions that often occur with reading disabilities or dyslexia, such as attention deficit hyperactivity disorder, language disorders, and those need to be identified if they are present as well so that we can help in terms of developing treatment plans for them.
So many great topics to talk about. I wanted to go on forever, but obviously we can't. Thank you so much for joining us for this great, important subject.
Thank you.
Thank you, Rick.
Thank you.
And coming up after the break, we're going to have Dr. Chilton and Dr. Joseph Harmon, resident Dr. Joseph Harmon, who's going to talk about childhood seizures and epilepsy. Don't go away.
Kids will spend 57 minutes making me go splat.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
Welcome back to For Kids' Sake with Dr. Lance Chilton, and the subject we're about to get into is very scary for parents.
It certainly is. I have personal experience with seizures in 2 of my grandchildren. Both of my daughters have had to deal with this and to take their children by ambulance to the emergency room.
So it's a very hot and scary topic. Obviously, we want the best information, so you went to one of the experts.
Right. Pediatric resident Joe Harmon is about to also become a neurologist, and he knows a great deal about seizures and epilepsy, so he's going to talk with us about that.
I look forward to it.
Well, I'm here with pediatric resident, soon-to-be neurology resident Joe Harmon. Joe, thanks very much for joining me today to talk about seizures and epilepsy. What are those things anyway?
Great question. So seizures are they're episodes, we could say, of decreased responsiveness or not responding if your name is called or if you're touched, and they can be accompanied by abnormal movements such as kind of stiffening of the extremities. They can be accompanied by shaking, or they can just be kind of staring spells, what we call, where the patient isn't aware of his or her surroundings. And so that's kind of loosely, there are a lot of different types of seizures. That's kind of loosely what a seizure is. It's due to some abnormal electrical activity in the brain. And epilepsy is, the term epilepsy refers to multiple unprovoked seizures, meaning that, for example, in children, there's no fever. If a child has a fever and has a seizure, that's not epilepsy.
And that happens usually in early childhood.
That does, yeah. Usually between 6 months and 5 years of age is when febrile seizures, and relatively common too. Mm-hmm. Yeah.
I have a personal interest in this just from about a month ago when my 10-year-old grandson had a clear seizure, was brought to the emergency room and treated. And I know how my daughter reacted. She was really freaked out.
Right.
Parents do that. What should they do? What should they do if they see a seizure? And is it always clear that a child is having a seizure?
Great question. So first, it's not always clear that a child is having a seizure. It can be difficult to tell. It sounds like in the case of your grandson, it was clearly a seizure. But seizures can be hard to see, hard to evaluate and know if it really is a seizure or not. What parents should do, or people who come upon a child or person who's seizing, they should try to help to get the patient or the child to the floor in an area that's not around sharp objects or things that they could or injure themselves on, and they should lay them on their side. Some people think that maybe they need to put their hand in the mouth or do something like that, and that's actually not a good idea. But yeah, experiencing a seizure can be very frightening, especially if you haven't seen one before, or if it's in your child or family member. So it's really frightening, but trying to remain calm, help the child or the individual to the floor, lay them on their side, and to call paramedics, call 911 and get someone out to bring the patient to the hospital, especially if it's the first time and that they've had this.
And so that's what happened with my grandson. What I've been trying to tell my daughter is that seizures aren't all that uncommon.
Right.
I think it's about 5% of kids who have a febrile seizure
yeah.
in the early years, and maybe 1% of the population has epilepsy.
Exactly, it's not uncommon at all, like you say. Pretty common, and as you mentioned, 5% of children can have a febrile seizure, but of those, still only about 10 to 15% will go on to develop epilepsy or have seizures later in adulthood. In fact, that number's a little less than that, more like 5 to 10% of children who have a seizure with a fever, a febrile seizure, will go on to have epilepsy.
So we usually treat seizures with medications. Some of them very old medications, some of them fairly new.
Right.
I'm interested in some of the work that you've done to look at what other measures people take to deal with seizures.
Sure. In addition to medications for seizures, there are other treatment options that work for different types of seizures. So some patients will be started on a ketogenic diet, which is a specific diet which helps to control seizures in patients who have recurrent. These are usually specific types of seizures, specific seizure disorders or syndromes, and usually after a lot of medications haven't shown to be very effective. There are other options, including what we call a vagal nerve stimulator, which is an implantable device that goes in the patient's chest. Usually a neurosurgeon will implant that, and they connect with electrodes to one of our nerves, the vagus nerve, which helps if a patient is having a seizure. A parent or individual who's there can activate it to try to stop the seizure.
You'd think that that with all the sort of hysteria that goes along with having seizures, there might be some folk methods of dealing with them as well.
Definitely there are, and in different cultures there are different understandings of what seizures are and what brings them on, and certainly different treatments. In the Hispanic culture, in kind of Southwest and Mexican at least, folk medicine, there are spiritual cleanses and a lot of herbs that can be used to treat seizures with good success. And a lot of people will, especially people who live in the United States, I think, and in other countries as well, will combine medication kind of from Western medicine with some of the traditional folk healings as well, to treat seizures, which I think is a good thing, as long as I think the physician should be aware of all the treatments and practices that are going on to.
Really important that we know that.
Definitely.
It'd be great to talk more about it. You'll be studying seizures a great deal during your neurology part of your residency, and I hope we'll be able to talk during that time and learn more. Thanks so much for joining me today, Joe.
Thank you.
Really good information, but one correction, right?
Yes, I wanted to correct one thing that I talked with Dr. Harmon about after we recorded that segment, and that is that really among those children who have seizures with fever, the incidence of having epilepsy later is really no higher than it is with everybody else. So it's really only about 1% in those kids too.
Okay, so that's good news.
It's very good news.
But that is a scary thing for any parent to have to deal with.
It certainly is.
Well, thank you for that interview. And coming up, we have a segment that we all love, and that is going up to the libraries. Tell us a little bit about that.
Well, I always enjoy going to the libraries for all kinds of reasons, but in this case, we're going to answer questions from parents, which is another enjoyable thing for me.
Okay, so please stick around, because we're going to go out to the libraries after this.
Every budget, so don't accept defeat.
Now you can get covered and still buy me treats.
You take care of your pets. Now it's their turn to take care of you. Visit getcoveredamerica.org to learn about your health insurance options.
What to do? Movies! To do or not to do?
Need a little culture? Check out the new online calendar and plan your night out on the town. Find film festivals, club events, and live theater. There's more to do in ABQ. ABQ to do GOV-TV.com.
Welcome back to For Kids' Sake with Dr. Lance Chilton. And now one of my favorite now and one of your favorite segments is the libraries.
Yes, we'll go out to one of the libraries again and answer questions from parents. I enjoy doing that. I always enjoy going to libraries anyway.
Excellent. And now you get to hear some of the questions that the parents ask. So let's take a look.
So I had a question about what's been in the news with the secondary drowning, where kids go swimming and they inhale water and then they are fine, but they cough later and have problems with fluid getting into their lungs. I've read a little bit about it, and it was on the news the other night also. So I just had a question because my in-laws do have a swimming pool that they take the kids in quite frequently. So how common is that? Is it something that happens frequently?
It isn't as common as we might think from news programs, but
Right.
it is probably certainly more common than we would like.
Okay.
Swimming pools are dangerous. They're wonderful if they're properly shielded from kids, but or kids are kept away from them. But it's really important to do that in communities like Albuquerque, where there's a lot of swimming pools because it's so hot.
Right.
It's really important that we watch our kids and that pools be fenced so that kids can't get into them.
Okay.
It is true that kids can be okay initially after near drowning and then later have trouble. That isn't common, but it is something that we have to think about.
Okay.
I think if your kids are being watched carefully by your parents or by yourself, and you have one adult for each person, for each child, you're probably okay.
Okay.
And being in there with them is a good idea, of course,
Right,
too.
right. The news program was saying that, or the story on the news was saying that even when they're swimming and they're swimming normally and they're in a floaty, if their head goes underwater and they inhale water, they're at risk for this secondary drowning, something with your lungs producing fluid after an intake of fluid. Have you heard?
I think that's vanishingly rare.
Okay.
I think I wouldn't be too concerned about
Okay.
that.
Okay.
That would sound like kids should never swim.
I
and
know, it was really
think
scary.
It's a great source of exercise after
Yeah.
all, and kids need to exercise.
Right, it's so hot to be outside right now that
Yeah.
so it's a good activity. Well, that makes me feel better because I didn't even want them to go near the pool at this point because it sounded like it happened frequently. So
No, I
Okay.
think you don't need to worry too much about that.
okay, great. Thank you so much.
Thanks for your question.
Okay.
And thanks for coming in.
Of course, thank you. Can you say bye?
Maya, thanks for talking with us.
Great questions, as always.
I love going to the libraries. You know, there's 17 branch libraries in Albuquerque.
Really?
Yeah, they're all over the place. I always talk with my patients about where the closest one is to them.
Yeah, and my kids are always reminding me all the time that we need to go to the library, Mommy.
Well, they probably particularly enjoy the activities. And if you go to the city's website, you can find out what activities are in the nearest libraries to you, or you can travel to farther away libraries and find out what's going on there.
And sometimes when you're at the library, you might run into Dr. Lance Chilton to ask questions to you, which is great, but what if they don't make it out to your session?
Well, if not, they're welcome to send questions to our Facebook page, For Kids' Sake, and also to write to my email address, which is in the column that I write every 2 weeks for the Albuquerque Journal.
Right. You do a column where parents can ask questions and you answer them, and that's every other week in the Albuquerque Journal. So look for that because I think that's really fun to give parents another perspective and another side of you, that answering questions directly to the parents.
I enjoy doing it.
So, well, we have enjoyed doing the show. It's always interesting, from dyslexia to seizures to the libraries. It's packed with wonderful information.
There's plenty to talk about.
Excellent. Well, we hope everyone will stick around for the next edition of For Kids' Sake. But for now, this is goodbye, and we'll see you next time.